Hi, my name's Ashley. I'm going to be doing the Module 5, Not What the Doctor Ordered prompts from Chapter 13. Here's question 1 and how I would respond. Question 1, what would you say to the doctor immediately after the incident? This would be my response. Hey, Dr. Smith, can I talk to you for a second? I noticed something during a procedure that I feel that you and I need to talk about. It looked like the medication was given without double checking the patient's first and last name and date of birth, which we always do whenever checking for patients and giving out medication. It looked like you just did not double check their chart and given their double verification of them. And I just want to make sure that everything's accurate for the patient's sake. I totally get how things move fast and definitely a hospital setting, but I just want to make sure that we're on the same page and what we're here for is for patient care and that we're doing things correctly for the patient. This is how I respond to question 2 about what I would say to my supervisor after I had already talked to the doctor. Hey, I wanted to bring something to your attention. I had talked to Dr. Smith previously, and this is something that I'd like to talk to you about. Not that I'm trying to get Dr. Smith in trouble or myself, but as a nurse, this is something that I take closely and that we're here to take care of our patients. So whenever we were giving a patient medication, and we always do the verification steps and double checking, making sure that we're handing out the right medication for the patient. And I noticed that Dr. Smith kind of overlooked like what had happened. And I really think that we need to be aware of and double checking that we are doing the right protocol. And that's our protocol as healthcare workers. And I understand that things can come just overlooked when we're really busy and things happen. But when I had talked to him, it kind of just went over his head and it was just not addressed. And I feel like he just dismissed what I had told him. So this is why I wanted to bring it to your attention. And I'm not trying to do it to get anybody in trouble, but this is just protocol. This is how I would respond to question 3 of what would I say if the doctor confronted me and an angrily matter after I had already talked to him and talked to the supervisor. This is how I would respond. Dr. Smith, I understand why you might really be upset with me, but it was no ill intentions. I didn't mean it to personally offend you or get you in trouble, but I tried to talk to you first because I respect you as a professional and I follow your work and I like what you do, but I just did not think it was right that we had already talked about it and you just kind of dismissed what I had said. And you and I both know as healthcare workers, we have to follow that protocol, definitely when it comes to patient care. But as I saw that it could just affect the patient, I had to say something, and that's part of my responsibility as a nurse. I hope we can move forward with this conversation or just dismiss and figure out the best way that we can problem solve this.